For this assignment, I interviewed a midwife at Semiemo Midwives in Surrey. Questions that were asked revolved around understanding the scope of practice and role of a midwife. The midwife I interviewed works 5 7.5-hour shifts a week, which also included on calls. In a typical shift, she'll have clinical visits and at-home visits for the day. Typical scheduling is reflected around the availability of our patients. Visits are 30 minutes in length, which she said helps build that relationship with her patients. I talked with my midwife about pregnancy with a physician compared to a midwife, and she said physicians perform assessments that are 10 minutes in length and will see the mother 1 week after birth. And during labor, they're only there when the mother is ready to deliver. Midwives, on the other hand, she said, are there throughout the entire birthing process, from the moment prior to birth and then 2 hours after delivery, and will continue to see the mother until the infant is 6 weeks old. To uncover the boundaries of her role, I asked which pregnancies were outside of her scope of practice. She said she can perform low-risk pregnancies solo. If the patient had a series of complications such as multiple pregnancies, head-first pregnancies, or required a cesarean, then they'll consult with the OBGYN on the case. She can assist the OBGYN on the C-section. The midwife, she said, just needs a special certification, which she didn't have. To uncover more of the boundaries of her role, I asked which tasks were outside of her scope of practice. She said the whole philosophy of midwives is to allow the mother a natural birth, so they don't work with induction. They can provide pain medication and can order epidurals, and the anesthesiologist will give the epidural. To uncover how much support they provide the mother both prior to delivery and after, I asked how often they would see the mother. She said they see the mother every 5 weeks until the mother is 28 weeks pregnant, and then 3 weeks until they're 36. And then after birth, it's 3 times in the first week at their home, followed by phone calls, clinical visits, and home visits in their second week. And then postpartum, it's in the clinic until the baby is 6 weeks old. She said this really helps the mother, in helping the mother provide care, especially with breastfeeding, she said, which can be a difficult time with the mother, especially with latching. So helping her, showing her different positions, and then providing her a supportive environment in which she can practice these skills. To uncover accessibility of service, I asked how much these services would cost, and she said midwife services is covered by the BC Ministry of Health for all BC residents with a valid care card or a BC services card under MSP. I wanted to know in what ways she collaborates with other members of the healthcare team, and she says besides consulting with the OBGYN during delivery, especially during hospital delivery, she said, nurses will provide support to the midwife by monitoring both maternal and fetal vitals and contractions while she delivers. So the interview I found really helped me in discovering the support and care a midwife provides the mother both during pregnancy and after.